All right, hello everyone. Again, my name is Hanson Lenyoun. I'm Director of Business and Clinical Outcomes at Samsung. I'm going to talk a little bit about what we're doing on the virtual rehab front, but in the context of the larger digital health portfolio. I think one of the really different things that large consumer device companies have to offer in the health space is their perspective and their view on how to pull together portfolios that appeal to individuals across a variety of different need states as whole people rather than just sort of in one unique condition. So, all right, here we go. The DNA of Samsung, it really revolves around this. As you kind of can see, if you look at the left side of the slide for you there, the product portfolio, right? Most people are familiar with Samsung hardware. Looking at a variety of different things in the home, across your body, and all sorts of different use cases from the user perspective. That also exists, however, on the services side of things for what we do. Fewer people probably know a little bit about that, but those services also meet a variety of different needs and serve a variety of different purposes for our consumers. And we see that same thing happening in the healthcare space. Samsung actually does have a pretty deep history in healthcare, although most people may not be familiar with it. A lot of it has happened in Korea, so we don't quite hear much about it here in the US, but it's more and more coming into to our realm as well. So all the way back to 1985, Samsung has had a presence in the medical imaging space. There's also a large hospital system within Korea that is run by Samsung. Medical schools, the largest cancer center in Asia. So a variety of really deep clinical experience that has existed over many, many years. Then we kind of get into the digital health space. Starting here in 2012, you can see Samsung launched S Health, which was rebranded as Samsung Health. Initially looking at the kind of fitness and wellness space. How do we help people get to meeting their unique fitness and wellness goals. And then that's really progressed over time to get into a lot of acute and chronic care conditions. And you can see here in the 2018 space a little bit more of a presence in the regulated space, working with the FDA and the pre-certification program on an app and a study with UCSF here in the Bay Area to look at how we can actually measure blood pressure using a sensor on the back of our phones. All the way to kind of chronic care with our diabetes wellness program, which I'll tell you a little bit more about as well. So when we think about the user, and in this case, the patient, we really have to think about them holistically. And so that's what I think we can bring from the portfolio perspective that kind of sets Samsung apart from a lot of other folks out there. And what that means, I think, is really looking at the full patient journey. So everything from that fitness wellness space for anyone and at any age that is really interested in kind of focusing on their health holistically, all the way to acute care, the post-acute care space, and then chronic disease management after that. And so through that approach, we've really got a variety of different ways that we can interact with our users, our patients, to be able to drive their health outcomes forward. So I'll give you a few examples in each of these spaces to kind of set the stage, but spend a little bit more time on the virtual rehab part of things. So first, in that kind of wellness space, I mentioned earlier that we've got the Samsung Health app that really touches on that kind of fitness tracking component. Beyond that, we've also got a program called Gear Up, which is focused on fatigue management. So if you think about things like regulated spaces, truck drivers, aviation, spaces where people have to be very focused for extended periods of time, and their ability to kind of make a critical error when they are fatigued impacts many people, their own safety and the safety of others. This is a space where there's a lot of need, and we have a solution that actually uses the wearable you see here to deliver the ability for these folks to be able to monitor their fatigue level, provide things like reminders to get up and stretch if they're in a physical space and if they can, or to take a break if they're a truck driver, to track their sleep and be able to monitor their fatigue levels themselves, as well as share that information with the controllers and operators that are appropriate for them. Moving on to the acute care space, as we kind of think about moving around that circle, within our Samsung Health app, which is included on every Samsung phone that's out there and has over 300 million users around the world right now, so kind of a very nice broad reach. Within that app, there is the opportunity to have a virtual consult with a physician any time of the day, anywhere. So we've really integrated this into the fabric of what we're offering from the perspective of being able to have health solutions for our users, so that it's not something new that they have to go and find and download in a moment of need. It's there at their fingertips, and it integrates with all of those other services and many of those other hardware options that you saw on that previous slide. Then we'll spend a little bit more time here in this post-acute space. So after somebody has had an event and they've needed some sort of intervention, there's a lot that we can do from the rehabilitation perspective. And this is, I think, a really ripe area for some work and intervention from the technology realm. And so one of the great things that we're working on that I'll kind of use as a way to illustrate what we're doing is a cardiac rehab program. So a little bit of background for folks that may not be familiar. Cardiac rehab is something that has a dramatic impact on outcomes over time for people who have had a cardiac event. Everyone should do it. About 20% of patients actually do. So there's a big disconnect there between what folks should be doing and what's actually happening. And a lot of that is because of convenience. Cardiac rehab programs traditionally require individuals to go to a physical center. They have to show up there 3 times a week for up to 12 weeks. And for some of these folks, it's as simple as walking on a treadmill while their heart rate is being monitored. So it may not have the kind of greatest payoff in terms of the time, the money, the copays that are required for them to do this, and their experience of the actual rehab, even though it is having a huge impact on their health and their outcomes over time. So as a result, you have a very low number of people actually doing it, and then a small percentage of those people that are actually completing the program, even if they do go to a center. So we decided to approach this problem using technology to facilitate folks being able to get this outcome-changing benefit much more easily. And we do that using a variety of different tools. So I'll kind of walk from left to right through the slide here. From the patient perspective, it really revolves around a wearable. So they have a Samsung smartwatch that both measures their heart rate as well as provides a little bit of information that can be served up directly on the watch face itself. It's LTE connected, so they don't have to kind of exercise with their smartphone, and they can do that anywhere that there is cellular coverage. They also have an app that they can download onto their own smartphone, so they can get the other aspects of cardiac rehab, educational content, medication reminders, all of those sorts of interactions with their care providers that are necessary and required to be able to create an engaging experience for the patients. All of that information is transmitted bidirectionally through our cloud to their care team, who has access to all of it through the clinical portal, where they can there kind of adjust the care plan, see what a patient is doing down to the individual exercise level, or kind of at the high, sort of panel of patient level. Who do I need to be concerned about? Who do I need to get in touch with? And we're really augmenting what these care providers are able to do and not replacing it, right? So the goal is to fit into the system as it exists now and allow them to scale their work so that they can actually get this intervention to the patients that need it. And then finally, on the chronic disease management side of things, we have solutions like this Bluestar and Diabetes Wellness program that you see here. So the ability to actually kind of engage patients using these devices that we've heard many times that they're using regularly to be able to achieve their health goals and manage their diseases over time. So just to kind of bring it back full circle, again, we think about all of these different kind of health use cases and experiences in an individual's life. And personally, I've had many experiences with every aspect of this. In my work as a physician, I actually trained in reconstructive surgery, so the non-cosmetic side of plastics. And I regularly saw patients in my office and in clinic that had these sort of non-healing wounds as a result of poorly controlled diabetes, right? And so instead of flapping them every month and providing wound coverage, it was let's get at the core of what's going on here and really work on getting your diabetes under control. And technology is really what enables us to be able to do that at scale and provide that kind of doctor-in-the-pocket experience. So we hope to be able to do that for folks both in the chronic disease space as well as at all of these different health touch points within their life. Thank you. Take some questions.
Questions for? Oh. Okay. Is there any way now, as a physician, to access the information you're gathering? Like, a patient comes in a consult that he gives me his file, he's been recording with all the sensors and stuff, or is it down the road?
So are you speaking in terms of the rehab specifically, or kind of anywhere along this kind of continuum of health?
Yeah, anywhere, like what the symptom checker has found or something like that. Can I get that in a file when the patient comes to me?
Yeah, so we have a few different ways. So kind of going back to the telehealth consult piece of things. So we work with a variety of different health systems to provide those telehealth consults. So if you are an individual in an area that has access to a system, say an Intermountain of the world, right? Then if you get plugged into their system and that is who you are going to see, then yes, that information is freely available within the system to be accessed, right? So it just kind of depends on the location and the way that the individual system is set up.
Thank you.
What's up next?
I know you said that if the patient is a part of a health system, then the care team can get access to that information. But does Samsung currently integrate the patient's information with any EHRs directly?
Yeah, so I think rehab is the kind of best place to talk about that because we are very integrated in with the care teams in those different types of rehabs. And it's very program dependent at this point in terms of what that integration looks like. It definitely does integrate. The question is how much. And I think a lot of that kind of goes back to what people were talking about earlier with the EHR integrations, right? It takes time for providers to get comfortable with providing you access to their EHR, to be honest, right? Which is rightfully so. And so once you're comfortable with what the information can provide and the benefit that comes along with that, we've seen programs be more open to having direct integrations. Otherwise, there are folks that like to control it a bit more and actually populate it with things that are relevant for them. Think in terms of like a SOAP note that you can cut and paste or something like that, right?
I'm asking a fundamental question. So what you're saying is your services through Samsung is only available for people in certain healthcare systems like Intermountain. A person on the street couldn't buy a Samsung wearable like the Gear Up or the smartwatch and have it connect to their physician because that technology doesn't exist yet.
So many services are available to anyone with a Samsung device. So for example, the Ask an Expert, telemedicine consult, that is available to everyone. You can use it right now if you have a Samsung phone. There are services that are provided directly through a health system, right? So for example, cardiac rehab. We have several programs that we're working with. It's live hitting patients right now across a large integrated system out west here. And so if you are a patient within that system, this would be an offer or something that they would offer you, right? But we're not directly going out to an individual and saying, hey, do you need cardiac rehab? Use this program.
So as a patient advocate, this is all wonderful and exciting, but it seems like accessible to the upper echelon of society. Can you give us an idea of how much such a thing as a smart watch what about people of color? What about people in other sections of our society?
So I think, again, that's kind of dependent upon the service that we're talking about as well, right? So with Samsung Health and the telemedicine component, for example, that's on every Samsung phone regardless of the price point, right? So even the cheaper phones have that included with it. When we're talking about things like the wearables and the programs that come along with that, that's something that's being offered by, in the cardiac rehab case, a cardiac rehab program, right? So that comes into the system of how is the hospital billing this, what does it look like, and it's not the patient paying for it almost 100% of the time, right? So it's really looking at how their sort of risk structure is set up, how they're kind of looking at it in terms of bundled payments or capitation and all these kind of different models that we have to work with, and it's different for every system depending upon what their unique experience is. So those folks are getting access. It's just a bit of a different way kind of to get there.
Hanson, thank you so much for that. Can I ask one final question? So what are some of the big mistakes Apple's are making that your Samsung kicking their butt?
I think the thing that we do really well at Samsung is try many different things quickly, see what works and what doesn't, and iterate, fail fast, and move on, right? So I think what Apple does really well is to kind of hunker down and come up with a long-term strategy and execute that strategy over time. But we want to hit the low-hanging fruit that's there right now, right, and roll things out quickly.
Awesome. Thank you so much, Hanson.
Yeah.